Now, family health insurance or private medical insurance in the UK is exactly the same as an individual policy, albeit it covers multiple family members, typically those that live with you at home, your children, your spouse, your partner, whoever that may be. Probably the only significant differences between a family policy and an individual policy is firstly, what you may well use it for, and also that with a family policy, there typically are some sort of discounts to reduce the cost, like if you add more than one child, the second child goes free. Without going into too much depth, let's just talk about the benefits of family health insurance. So firstly, you can be seen and treated much, much faster. Waiting lists in the private sector are still far, far shorter than those in the NHS. So if you or a family member needs medical care, you will receive that care much, much quicker, allowing you to get back on with more important things. Second, you get a private room when you're in hospital, often with an ensuite bathroom and relaxed visitation times so that you can come in more often and see your family members and you're not on a ward with many, many other people. Most insurance policies will include at least some level of mental health support, and you can pay a bit more if you want to get further mental health cover. Especially with young people today, my kids are maybe a little bit too young for this to be too much of a concern at the moment. But as children become teenagers, there is this prevalence of mental health issues. So having health insurance does enable you to access mental health support services. And as I say, if you opt for mental health cover in addition, then you can get access to all sorts of talking therapies and even psychiatrists. Another general benefit of health insurance, not necessarily family health insurance, is that you've got more choice over where you're treated and when. With the NHS, we're kind of all used to being told you've got an appointment on this day. And if you can't make that appointment, then maybe you're going to have to wait longer again to get another appointment another time. And it's usually at a prescribed location. With private health insurance, you get more say. You can choose who's going to treat you in some cases and where you're going to receive your treatment. And often at what time as well. So you can arrange your treatment, your medical care, to take place at a time and place that suits you and your family around your other commitments. Finally, and something that I'm going to talk about a little bit more because it's been especially beneficial to myself and my family, is the virtual GP services that you get. So you get access to a private GP on the phone or via video 24/7 hours a day. And we'll come back to that in a minute. Depending on which health insurance provider and policy you opt for, what's going to be covered by your policy is going to vary quite substantially. However, all family health insurance policies will, at a minimum, cover the cost of you being treated or your family members being treated in a private hospital as an inpatient or a day patient. So that means you are admitted to hospital, let's say for surgery or some other major treatment. Now, what you tend to find is many people will then opt to add a level of outpatient cover. Outpatient cover enables you to access things like diagnostic services, so you can see consultants and have tests done and x-rays and all these sorts of things. You can have those done privately by adding outpatient cover. If you don't add outpatient cover to your policy, then all of your diagnosis will need to take place via the NHS. So you go to your NHS GP, they would refer you to somewhere in the NHS for tests and consultations, and it would only be at the point that you get a diagnosis and you require surgery or treatment that you would then be able to claim and go private. So many people do opt for outpatient cover because it just means that from that initial referral or after that initial referral from your NHS GP, or perhaps the private telephone GP, you can immediately go private and get your consultations, tests, and whatever else you need to reach a diagnosis privately. In addition to outpatient cover, you can enhance your policy further by adding things in like routine dental appointments or opticians costs. You can also add travel cover, for example. You can add cover for visits to see people like a chiropractor or an osteopath. So health insurance or family health insurance can be super, super flexible. And whilst at its very, very core, it will cover you for treatment in a private hospital as an inpatient and a day patient, many people, or most people, will then adjust their policy to suit their individual requirements. So I'm just going to talk very briefly about what is covered by health insurance or family health insurance and what's not, because it's important that you know what your policy is going to cover. And this is a bit of a generalization, I have to say. Please, when you start looking at health insurance, review your provider's documentation, speak with a broker, make sure you understand what's covered before you take out the policy. Health insurance is designed to cover acute medical conditions, meaning those that typically you can recover from after a short course of treatment. It doesn't cover chronic medical conditions, so things that maybe need management, let's say asthma or diabetes or high blood pressure. Health insurance isn't designed to cover those conditions. Health insurance also excludes any pre-existing medical conditions, typically in the last 5 years. So that's anything you've had medical advice on, suffered symptoms on, or had treatment for will be excluded, and often conditions related to that exclusion will also be excluded. So health insurance isn't a silver bullet. You're still going to need the NHS. It also doesn't cover things like emergency services or cosmetic treatment, and there are more exclusions that you really need to be aware of before you take out a policy. As I say, it's really designed to cover acute medical conditions, those that you can usually recover from, say things like major surgeries or let's say cancer. And if you've got mental health cover, then also mental health conditions. So I want to tell you a little bit about where my wife and I see the biggest benefit from family health insurance. We've only had a policy for a few years. And the biggest game changer for us, our kids are 4 and 2, they're always getting on. There's always something going around with school and nursery. The biggest game changer for us has been access to the 24/7 virtual GP that you get with a policy. Now, often with these virtual GPs, you need to make an appointment. So yeah, there's 24/7 access, but you're typically making an appointment for later that day or the following morning. But the access is there, it's pretty quick. Now, to give you an example, say one of our children, let's say my son, 4-year-old, comes home from school on a Friday afternoon and he's got a temperature, he's got a raging temperature. Now, it's 4-5 o'clock in the afternoon. It's going to be very, very difficult for us to get in and see our NHS GP at that time of the day. So we make an appointment or we ring NHS 111. They ask about symptoms, they do their triage, and they say, yeah, we're going to call you back. It could be up until midnight, 2 o'clock in the morning. Then you're waiting for your phone to ring for that phone call from NHS 111. They call, a physician or a doctor, nurse calls, and they go through, again, medical questions. Potentially you need to wake your child up. They say, you need to take your child down to an urgent treatment centre. And it is just tiring, stressful, and it's not particularly great for anybody. Okay, you've got medical advice, but at midnight or 2 o'clock in the morning, it's not ideal for the parents, and it's certainly not ideal for the child. Now, in contrast with a virtual GP, and they can't do everything. Like there's some instances where you really do need to see somebody and have a physical examination. But using the example of my son coming home with a temperature, you make an appointment to see the virtual GP. And if it's not that evening, it's the following morning. You have that appointment. And in most cases, they're going to be able to help. They're going to be able to offer some form of diagnosis there and then. They may ask for you to send some photos through. But off the back of that call, they're going to give you a route forward. Now, that route forward may be, okay, you need to go to A&E. It could be that they send antibiotics to your local pharmacy or a different sort of prescription. Or they may say, yeah, really, you need to see a specialist, or actually you need to go and see your NHS GP. But whichever way it ends up going, you've got expert medical care in a timely fashion without all of the stress and everything else that goes around it. And that gives you a high probability that you're going to get your child better sooner, so you can get back to work, your kids can get back to school, and everybody can just get on with life and get over the latest bug that has come into the house. So as I say, we tend not to think about the bigger things, and of course, children develop cancer, and adults and family members do too. And that is, that's a huge benefit of health insurance, that you get access to major treatment services as well. But in terms of day one, what are you going to get out of this? What will you actually use? Because often with insurance you buy, you don't really use it. It sits there in the background and you only use it if the worst happens. But with a virtual GP, with your health insurance, I promise you, it is something that you will find useful from day dot. It's not going to be for everybody. And again, health insurance isn't always cheap. And I'd invite you to go to our website, mytribeinsurance.co.uk, to learn more about how health insurance works so you can make an informed decision. Always speak to a broker, always get financial advice, make sure you understand what you're getting before you buy it. But from my experience as a parent, health insurance has been hugely beneficial to our family, so it's well worth looking at.